we looked at our network combined with the Ascension network and realized we had a great opportunity to provide coverage across virtually all of the lower part of Michigan. And we thought that would be a great basis for our product. We talked to some payers and who agreed that there actually would be an opportunity, an attractive opportunity to offer a network that featured our combined set of hospitals. We also knew that we're all working together, not working together, but we're working now on creating clinically integrated networks that are effective at managing population health and producing triple aim outcomes of better health, better care, reduced costs. And we knew that a lot of our markets kind of overlap in some ways. And if we could coordinate patient care better by working together, that just made sense. And we'd be able to offer a better product. So we hope that by working together on some of the new capabilities that we'll be able to make some of the administrative costs lower. But we think the most important opportunity is actually in coordinating care across our respective networks and making sure that we are doing that effectively and delivering great care to a patient regardless of whose emergency room they show up in. Well, it is hard. I think that's right, and I think that's why we're hearing so often from institutions that aren't aligned with a larger system, looking for help, looking for novel arrangements, not necessarily just merging, but looking for novel arrangements, ways of supporting them. I think we're just at the beginning of finding out what those arrangements might be. So it's difficult for sure. There's a level of sophistication that you need to do things in this new world that we're just learning about. Much as I think compliance is a great example. You need to be pretty sophisticated and make a significant investment in developing a state-of-the-art compliance program. And we've done that, and I think other hospitals find that to be of value. And we find there are times where people are just interested in getting a service like that. Similarly, in this transition to population health management, we're finding that you need sophistication, you need to make significant investments, and I think what will happen is people will evaluate their particular circumstances, decide how much help they need, decide how well off they are, I guess, and then make decisions about different kinds of arrangements. And I think we're just beginning to find out what those arrangements are. This is one example of where a different arrangement, a joint venture approach, made sense from a community standpoint and from a business standpoint. It's always been the right thing to coordinate care better, to have care management and care managers, right? To measure patient satisfaction aggressively and improve it. It's always been the right thing to do. But the reality is that we're facing a world now where, number one, people are demanding it, and number two, there are models evolving that support the provision of those services, right? And so you can think about, I think about the population health dividend as being the dollars that are generated through the savings as a result of applying these new care mechanisms. It's a dividend that's available to society at large, right? It's important for communities to benefit by having lower costs, both the payer level, the insurer level, and out-of-pocket costs, et cetera, for patients, so they benefit. But it's also important that some of that be put back into the system to fund these new services. Yes, we'll have to make investments up front, but the key is to find opportunities to get reimbursed for those investments. And there are some fee-for-service opportunities that are available from private payers for care management fees, transition of care fees, and there's shared savings opportunities that are available. There's upside opportunities around like percentage of premium arrangements that don't necessarily involve downside risk. Ultimately, they move to probably including some downside risk, and ultimately they move to some sort of prepaid capitated arrangement. So that's kind of the spectrum of reimbursement opportunities. And what we need to do is make sure that we time our investments in these new activities with changing our business model to secure contracts with those kinds of arrangements. And that's exactly what we're doing.